for joining me on the Healthy Hits. We have Juliana and Ayushi and Belinda. I'm so sorry, Belinda. I just met you.
Surprise guest.
So joining us as surprise guests from our second year in medical school. And this is our Ask a Med Student episode. So before we get started, I'm going to get started with a disclaimer. This is a general health information podcast. Please do not use anything here for medical advice. If you have an issue, go see a doctor. Do not treat yourself. Also, we are in no way endorsing any products. If you see Ayushi pull out something and use it.
Personal use only.
Personal use only. And the opinions of everyone here is representative of themselves and in no way affiliated with Carilion, Virginia Tech, Carilion School of Medicine, or Virginia Tech. And disclaimer. So how are you guys doing tonight?
Good. Doing good.
Good?
Tired, as always.
Groovy. It's my favorite word to say.
Copacetic.
Tired as always. Is that a result of being a med student?
It's the result of being a student. I feel like it's the result of being any student. Yeah. Or being a Yushi, I guess.
Okay. All right. This question. But for the sake of just knowing when you started med school, how old are you?
I'm not supposed to ask a lady her age.
I know. I'm a lady and I'm asking other ladies. But I guess at what age did you consider going to med school and being a doctor? And what age did you enter med school?
I started thinking about being a doctor back in high school. I started considering it seriously when I was about 19 after my first year of college. And then I'm now 25. I started when I was 24.
Okay. Juliana?
Technically, I started being interested around the age of 4, which I know sounds kind of unbelievable, but in my preschool yearbook, I did write that I want to be a doctor. In reality, probably high school is when I really knew I wanted to go into medicine in some way, shape, or form. And then in college, I was like, I definitely want to be a doctor. I'm committed to this route. Let's see if I can make it happen. So I started med school at 22, and I'm currently 23.
I actually had no idea I was going to do medicine until I was like 21-ish, 21, 22 years old. I entered medical school at 23, and now I'm 24.
Okay. Very cool. Okay, so what was the thing that made you want to be a doctor?
I have my med school application answer, which is I love science, I love helping people, all that. But I think the real answer is that I'm just a huge nerd. I think that's the most accurate answer.
Well, maybe you should join me on the research side.
I did think about it. The difference to me is that in research, you sort of have to justify yourself to a lot of people a lot of the time in grant funding, whereas as a doctor, your words and your experience, you're able to help people with your knowledge, which is really appealing.
Very cool. So do you have a specialty already?
I'm interested in working with older people, so potentially geriatrics, but we'll see.
Okay. I'm so glad you specified geriatrics, as I am now approaching middle age. Thank you for that. All right, Juliana, same question.
I think I would agree with the being a nerd. I think that's very true. But I think what kind of drove me more towards medicine rather than strictly research is I wanted the patient connection. I wanted to be able to see how what I was doing was making a difference in other people's lives. And I think sometimes in research, you don't always get to see that, even though you are definitely making that difference. And I wanted the more longitudinal care and seeing patients over many years, which is kind of what drew me away from doing things like strictly EMT work or other first responder jobs.
Very cool. What about you, Ayushi?
I was actually one of those physicians birthed from COVID-19.
Oh, interesting.
Yeah.
Okay.
So before that, I don't think medicine was in my radar at all. It was more like, if I'm sick, I'm going to go to the doctor, and that's about it. Mm-hmm. But when COVID hit, my family was hit as well. And I got to see a side of healthcare that was burdened, which I'd never even imagined or thought about as possible. And witnessing that really pushed me towards wanting to do medicine. And a lot of what you all said, that like because of that experience, I wanted to make a difference in people's lives that went beyond what I was doing at the time, which was being a computer science major. So
Well, I mean, you're going to use so much of that as a doctor. A lot of people, I think, don't know how much else goes into being a doctor, which I think is pretty cool. And we'll talk about that in another episode. Shameless spoiler alert. But that's really cool. Very cool. You know, I never thought about COVID in a positive way like that, of kind of bringing in more nurses and doctors. And a lot of them fell off the grid at that point.
actually, I mean, don't quote me on the statistic because I could be very wrong, but I'm fairly certain around COVID time, the number of applicants for medical school increased. around
Yes.
that time.
Really?
Yeah.
It did, for sure.
It tends to increase every year, but I think it increased a little more.
That year, yeah.
Well, all right. Humanity, we have a light. What specialty are you guys interested in? Ayushi, Juliana?
I'm interested in neurology.
Neurology.
Yes.
Okay. What drew you to that field?
Oh my gosh. This goes back to being a bit of a nerd, I think. I'm a neuroscience major. I
Mhm.
love the brain. And going into medicine, when I first started medical school, I was like, I'm going to be open. I'm going to try everything out, and then I'm going to commit. And I don't know, I just went right back to neurology like within a year. So it kind of feels like it was meant to be.
Very cool.
So I'm interested in neurosurgery, and what really drew me to that was the brain. First of all, I think it's an incredible organ, and I think learning human behavior and seeing how when the brain is disrupted, whether it be from a stroke or whether it be from seizures, and how that manifests in people's actions, both behavior and in motor systems or in sensory systems, I think is so fascinating. And then having the ability to actually change and manipulate different neurological disorders kind of brings in the surgery aspect. And I think combining the two makes neurosurgery kind of the perfect option.
Very cool. Okay, guys. So let's switch over a little bit to thinking more about med school itself. So you all kind of entered at different stages of your life thinking about it. What was the hardest part about the application process for you?
I think I'm alone in this group in that I applied twice. So I think the hardest part for me was just the sort of soul crushing nature of having to present yourself to these medical schools. And I think part of the frustrations with the process is that every school presents itself as like a holistic application process. So then when you're rejected because of who you are and not just because of your grades. So that messaging can be frustrating, but for any like applicants out there, the word holistic just means that they do care about more than your grades. It's no reflection of you as a person, on paper. It's, don't let it get you down.
Very, very true. And that just means there were a lot of awesome people too that applied. So, okay.
Very true. For me, I ended up going straight. So I think the hardest part was figuring out time to study for the MCAT and take the MCAT while still doing a full course load and in school. It's just realistically hard to manage. It's kind of actually what we're doing now. When you think about it, we're preparing for step one, but we're still in classes, even though we do get some dedicated time. With the MCAT, we didn't get any of that. So that was challenging for me.
I think a lot like you, Belinda. I think because it's a holistic process, thinking about what parts of me I want to quote unquote shine or not shine, and just like having to think about myself to that extent for a period of time, it was actually very exhausting because we don't really think about ourselves that closely or carefully until we have to present ourselves to a bunch of faceless individuals through essays and whatever else is involved. So
That's very true. I feel like the application process and since has like allowed me to be more introspective and think more about not necessarily myself per se, but either things I value or things I'm looking for in other people or in a school or stuff like that.
I think the attitude you have when you're facing those questions matters a lot, because some of them I definitely faced it with like a, why do you need to know that for me to show you that I would be a good doctor? This feels a little silly. And then other ones where I sort of allowed myself to really treat it as like an exercise in introspection. I had more fun with those. And I feel like I was able to grow from the application process in a way that I didn't really expect to.
That's so true. Some med schools have such fun essay topics that like sitting down and writing them is actually enjoyable.
Here.
Yes, I had a lot of fun writing this one.
Virginia Tech, I mean, not to like say Virginia Tech's a great school, even though it is, but like they had a really fun set of essays.
Very cool. I never had that experience writing essays. I'm just saying that I hate to write. So, but that's really important to know. So what about life as a medical student? So you touched on kind of studying all the time, studying for STEP, and then still taking classes. Kind of walk me through your day-to-day life.
So I would say most days there's some component of class time. This is in your preclinical years, just to preface that. When you start medical school, you're in your preclinical years, so you're having classroom learning with some supplemental clinical experiences and volunteer and all that stuff. But really, classroom. So you spend a couple hours in class, and then I spend the rest of the day until my next activity studying, which can either be 1 hour, it can be like 5 or 6 hours. And then that next activity can either be through school, like anatomy lab, or they have us go on longitudinal clinical experiences. Or it can be something that I've planned for myself, like a really cool volunteer opportunity or research.
What is a longitudinal experience?
You are assigned an outpatient physician who you shadow like once or twice a month for 18 months. And it's 18 months, right?
18
months. About that time. It's interesting.
And I'm not sure if this is specific to Virginia Tech or other schools do it too, but we've at least had that chance.
Okay, so it's shadowing with one clinician, the same clinician
yes.
for that extended period of time.
Yes, and you can be in really any different specialty. It's pretty random of how you get assigned. For me, I ended up getting paired in family medicine, so that means I get to go in a lot and interact with every patient and interview them, ask them why they're here, even perform physical exams. So listening to their heart and lungs, it's a really great opportunity to actually feel like you're going to be a doctor and you're practicing the skills that you will someday be doing.
Okay. So the classroom time, does that vary day to day? Like, do these activities vary like Monday, Tuesday, Wednesday? It's all different?
Yes.
Or is this based by, I guess, your semesters?
I would say it is a little variable day to day. So generally we have class from 8 to 12 every day, with the exception of Tuesdays, we have afternoon class and we have it 1 to 5. So that's the day when we practice our physical exam skills. And at the same time, we also go to, we call it the VIO. So it's anatomy lab. So we do some dissections on whatever the topic is for the week. And it always coincides with whatever we're learning. So if we're learning about the heart, we'll do a cardiac dissection. We could do that for a few weeks. The remaining days of the week, so Monday, Wednesday, and Friday, we have PBL, which is project-based learning. So we're in groups of 6 to 8, and we work through complex patient cases together for 2 hours each of those days. And then the remaining time we have lecture and we have patient wrap-up on Fridays, which I don't know if other schools do this, but it seems pretty unique. A lot of times the patient will come in, that whatever case we worked on that week, and we'll get to hear their story from their own words, even though we read it. Hearing it's always different. We get to ask them questions and interact with them. And then their attending physician will be there too.
Okay, that sounds really cool.
Yeah.
So you get to even hear even further out, like how they're doing, how their recovery is, or whatever. Like, that's really
Yeah.
Very
It's
interesting.
awesome.
It is.
They should adopt that. If this is the only place doing it, they should definitely adopt that other places.
I agree.
So your PBL, problem-based or project-based learning.
Problem-based, I think.
Yeah. Okay. So is that like, I'm imagining an episode of House. Are we talking like that kind of scenario where
Feels
they're
like that
throwing
sometimes.
like symptoms at you, or are you given like a case report? How does that work?
So we're given a case, essentially, like we start with like a story of a patient, usually like they come in with a problem, like I have a sore throat, and then we slowly we go through different aspects of their health, so like their physical exam, their lab reports, the story itself, their family history, and as we're doing this, we're sort of thinking about based off of what they're telling us, what could be the issue, or what could the problem be that they're for the reason why they're experiencing whatever symptoms were given. And really the point is to have the opportunity to talk with our classmates and discuss what problem this patient could be going through, because that in itself is a learning experience, I think. Diagnosing a patient is something that happens in a team effort a lot of times, and being able to interact with your peers and do that is a very important part of becoming a clinician. So,
and something I like about our problem-based learning is that diagnosis is usually the first day, maybe sometimes the second day, and then we move into the treatment aspect. And with treatment comes complications, which I think is valuable going into medicine, knowing that antibiotics are not a magic bullet, and surgery is not a one and done. There are complications, and there are follow-ups, and there are recurrences, and having that journey in mind, I think it makes it more of a realistic experience.
Not okay. I say nice, and not that that's a thing, but nice as in that is much more realistic. That's really cool. So I guess, do they do kind of cases that are more real world, where like you come in and your patient's actually got like 10 things wrong with them, and it's
Yes.
that I mean that's just
Yes.
life, right?
Yeah.
Like you may have heart disease and a smoker, and you may be overweight or have diabetes, and you may have these things, and that's just your normal day to day. And then he has something weird, or he or she might have something else, and it's like, oh, okay, these other things are not related at all. This is the actual issue, but we also have to deal with all these things. So you get to tease all that out.
Yes.
They're that kind of complex.
And not even just that they have those conditions, but what medications are they taking for those conditions, and how might those medications interact in a way that might make something appear like a condition. So there's like a lot of different,
Nice.
if someone comes in with a sore throat, and could it be a cold, or could it be like, esophageal reflux from one of the medications that they're taking?
So it is kind of like House.
It's like
feels
House,
like House.
except I would say there's as much emphasis on treatment as there is on diagnosis.
That's awesome. Go do the scans and stuff, obviously, but
Wish we could.
that would be cool if they could like make you do fakes, or like teach you the scans and whatnot. Say, oh, by the way, you did this, and here's your result. And
They do
That would
give
be
us
awesome.
scans. They do give us
Oh, okay.
Integrated in the case. There'll be CAT scans or X-rays or EKGs, and then there'll also be lab results. So we do get to see what was actually done for that patient, and we can take a try at figuring out what the diagnosis was, and then it'll always tell us. It'll give us a description and tell us at the end what it actually was.
And we are learning how to do a point of care ultrasound. So
Okay.
recently we had some pregnant patients come in, and we were able to, actually take a look
Actually
at
do it. Very cool.
their babies.
Nice. Well, you seem very excited about that. So maybe thinking about OB. No?
I like my patients over 80.
That ultrasound was an incredible experience. So just like getting to see life.
Yeah.
Yeah,
in that way.
yeah.
You just don't think about it until you're doing it, and it's just like, oh.
Very cool.
I never thought I was going to get that opportunity.
Yeah.
It was fascinating.
Right. Now, is this the ultrasounds that are like the 4D, 3D, like the really cool ones that you can see these days?
Oh, so that's usually like CTs that you can take in combination with maybe like angiography or something, and it lets you map things out. And you can like rotate and repeat.
Yeah.
With ultrasound, you're basically just putting a wand on someone's body part,
Right.
and then it gives you a black and white image
Right.
from the skin down.
Right. But I've seen them now where you get the baby pictures and it's like a full 3D.
Oh,
Yeah.
so I've never heard of that.
My
That's
cousin-
Yeah, wait,
cool,
that's
though.
cool.
Yeah.
So awesome.
My cousin's newest baby, Willow, she's turning 1 now. But her ultrasound, the picture she was passing around was this 3D image of this. I'm sitting there going, no way, I can actually tell
Yeah.
that's a baby. Like not just a
So cool.
little
Wow.
thing on a sonogram.
That's
I was like,
amazing.
so I was just curious if you guys get to play with those kinds of toys. That's
I
No,
wish.
that's gonna be something I'm gonna Google later.
Yeah, for
that's
sure.
really cool.
Maybe in the hospital they have something like that, but
Mm.
we don't train on anything like that.
oh,
At least not yet. You never know,
oh, that sounds like I would have to do a rotation just to play with that
right?
and see what I could do. Very cool. All right, ladies. So, what is something that you would give advice wise to your younger self or to someone that's saying, I think I want to work with people and I think I want to work in the medical field? What advice would you give them?
Be 100% sure that you want to pursue medicine. I think one of the things I really appreciate about the process is that they really make you question whether you actually want to pursue. It's like, okay. They really make you question whether you actually want to pursue medicine and why. And that in itself was, I don't know, that was a great exercise for me. My parents at first were like very resistant to the idea of me doing or pursuing medicine. So like getting the opportunity to sit down and be like, this is the many reasons why I want to do it. And I'm 100% sure was, I think, very important to solidify and motivate me. Because it gets exhausting and tiring. And I think on those days when you're just like, I'm done, I just want to go to bed and be done with this, I think you need that reminder of why you're here.
And sometimes it's not even that, you really want to do this, but there's nothing else that you would ever be happy doing. And I think that's where I found myself is, I might be stressed about a test or something, but I'm just having so much fun learning all the stuff that we're learning about and like really learning things that it's really a privilege to get to know this much about yourself and other people's bodies. And there's just nothing else like that. So
I would say something that this school says a lot is find your North Star and find your why.
Yeah.
Like if medicine is your North Star, that's awesome. Like we'd love to have you join us, but if it's not, that's okay. Like find something that you're going to be happy doing. Like try out medicine, like shadow, become an EMT, or like do anything that gets you clinical experience. Go in a research lab, try that out. See like what you like and what fits best with the lifestyle you want, the type of work you want to do. There's no other way to really know.
Yeah.
Shadow. I think shadowing is really important, and don't just shadow for one day. The longer you can shadow a single person for, the better, because you'll see the frustrations, you'll see the annoyances about, electronic medical records and billing and like the side of medicine that's not just the like fun diagnosis and treatment, but the like writing
The real
notes
world.
Yeah.
and, dealing with irate family members and everything.
The actual day to day.
Yeah.
Peek behind the curtain.
Yeah.
Exactly.
All right. Is there anything else you would like to tell our viewers?
Medical school can be a lot of fun. Like I think people treat medical school and residency as like very much a means to an end, where the joy is at the end. But I think all of us, we've found joy throughout this. And the more you can do that, regardless of what it is you do, I think the better off you'll be. So.
And I think we've created a lot of great memories. I mean, we're a smaller class, so I think it's happened a lot more, but we've like created bonds and relationships that are probably going to like stick with us
Yeah.
for years to come. So
Yeah. Find a way to have fun with whatever you're doing. I mean, don't, like you're saying, don't look at it as just a point you need to get to, like, oh, I need to get to be a doctor. Like, you will be. Like, you're on this path. Like, enjoy it, because every day is precious, and every phase of life that you're in will soon go away. And you'll look back and say, oh, like, those memories that I made, like, I wish I could be there again. So enjoy whatever stage of life you're in.
And also, like, at the same time that you can have fun with this, it is your priority. Like, you do have to accept that you'll be missing things that you would have otherwise gone to, which it is a sacrifice. It requires sacrifice. Don't put off happiness, but also understand that if you do choose to go to medical school and go down the path to become a doctor, that is at the center of your life, at least for a while.
Yes.
All right, ladies. Well, thank you so much for your time and joining me this evening and your insight into medical school. So hopefully you will come back and join us another episode, another time. And we'll see you next time. Bye.